Suddenly, medical security has become a do-it-yourself project.
Yeah, well, I hear doctors all the time. It's like, I'll just do it myself. I'm not paying that. Really?
Yep.
That's what I thought next time, I need open heart surgery. I'll just do it myself.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
This is Jeremy from Oral Facial Implant Specialist in Deer Park, Illinois, and you are listening to Help Me with HIPAA podcast.
Thank you for that intro. I'm David Sims of HIPAA for MSPs and Security First IT, and joining me is Donna Grindle of Cardin. Good morning, Donna.
Good morning, David. I feel like it's Groundhog Day.
We have not had so much trouble recording an episode in forever. Like never has it ever happened to be so much trouble.
No, that we're on multiple tries of multiple days. It's ridiculous.
Yes. So either this is going to be the best episode ever, or it's going to be just horrible. There is these powers that be are trying their best to get us not to talk about this. So,
Right.
Yeah. Anyway, that brings us to our topic for today, which is exposed images on the internet. And no, we're not talking about the ones on your phone that you're like, I hope nobody sees. Because we know you have them.
Well, that's why people freak out over that spam email that we've got pictures of you on your computer doing things that are nasty.
Yeah. I was like, cool, man, send them to me. But yeah, we're talking about images that come from PACS systems, x-rays, MRI scans. Man, these things have been like all out there on the internet for months. And, people know about it, but they're not doing anything to fix the problem.
Well, it's been months they've been out there that everybody's known that they're out there. They've probably been out there even longer. So that makes it even worse.
Absolutely. So, we've tried to sit on this for a little while and not talk about it until it was kind of patched and done, but it's not getting patched and done. So time for us to jump out there and talk about it.
Let's do it.
All righty. So before we dive into that, though, let's have a few announcements. First of all, we'd love to have you subscribe to our podcast and leave us a review. So go to Apple Podcast or Spotify or wherever else you get this amazing content and leave us a review. We appreciate it. But we do have our 2020 spring session for the HIPAA Boot Camp. We've already been announcing it. It is March 24, 25, and 26. So if you need any more information on that, you can go to thehipabootcamp.com. And we also already talked about the fall session. Even though we have no idea where it's going to be, we do know the dates that it's going to be.
Yep.
So,
we're still looking at trying to get out there. We're in negotiations for a place in Phoenix or Los Angeles. So,
yep. So we're trying our hardest to get out there to those people on the left coast. But stay tuned for more on that. But it will be September 15, 16, and 17. So if you're interested in going, go ahead and mark those dates. Shoot, just go ahead and pay for it. We don't know where you'll have to go, but you'll be registered to be there. Anyway, anything else you want to say about the boot camps?
No, just they're awesome. Y'all come now. You hear?
Y'all come. Yeah, it's always more than people expect. So that's the fun part. Even after day one, they're like, holy cow.
And they can't believe that it was not painful.
Oh, I know. They're like, this was actually fun. Yeah, I know. It gets better. All right. So before we dive into today's topic, let's hear a word from our sponsors.
Are you frustrated with your current IT provider? Are you sure you're getting the security and protection you need? Are you putting your patients and your practice at risk? If you're in the Charlotte, North Carolina area, give Security First IT a call to learn more about how they can protect your patients, your practice, and your bottom line. Find them online at securityfirstit.com or call 980-288-5100.
The number of medical practices that think they're HIPAA compliant is pretty staggering. Effective privacy and security are an ongoing process, not a checklist. And that's why at Cardin, they don't just assess your situation and leave you with a report, but they work with you all along the way. Call Cardin today at 678-292-5001 or visit them on the web at cardinhq.com. Aren't your patients worth it? All right, we are back. Let's talk about Donna's images exposed on the internet. You know, kind of like the time you were, come on in, the front door's open.
Lack of security, boy. It's hard to believe that's almost 5 years ago, but yeah.
And yet we still get a hard time about that. I don't get it. Shout out to Carla for not strangling me for letting that go through.
It's one of the first 5 episodes. When you hear the opening, you'll know which one.
Yeah, go listen to the first few episodes, and yeah, you'll know it when you hear it.
and you can tell how much different we are in recording and actually having a clue how to do it instead of, hey, let's record this stuff and see what happens.
Yeah, we kind of do stuff like that. Yeah, before we started recording today, I was like clicking things like, hey, I wonder what this does.
Yeah, and off we went.
Yeah, those things that you tell people not to do, that's what we get paid to do.
Yeah. Let's see what happens when we do this.
Yeah, and so we can tell everybody else. All right, so let's get into the topic for the day. So you used to work in radiology billing, so this hits home for you, right?
Well, yeah, I had a lot of clients that were in that, and I did all this automation, and it was really cool stuff. So I really would take data out of the PACS machines and send it over, get it coded, send it back, bill it, and it would be all automated and all these systems transferring data. So, I was getting nerdy with it, but it gave me access to a lot of different PACS systems. So just a little learning moment for those who don't deal in this stuff, because it's worth learning about this when you learn there's over 1 billion images that were just out there for everybody. So that's why we're going to do a little teaching moment. So there's this DICOM standard, and it's old, but this is how we will exchange images. And it goes back to like originally in the 80s, and when HIPAA came around, they added the ability to encrypt the data and protect the transmissions. That's good news.
Yeah.
But, bad news is it's not required by default.
Mm-hmm.
And you can now, because, we've got everything we need now, you can get free imaging viewer software. So you can do it in a browser with an extension. You can get software for any operating system that'll let you download those images and view them. And you can see for yourself all of the data that a radiologist would see when they're reading it. Got it?
I've got it.
So, good idea, right? You get this great high quality image. You can, see it and it's digital and all these great things. And so then they said, well, we're going to create these PACS systems, and it's PACS, Picture Archiving and Communication System. And they are everywhere that anybody's doing or reviewing any images, because no matter what you can imagine creates an image. So there's ultrasounds and sonograms and PET scans and, whether it's ophthalmology or dental, or it doesn't matter. If they're creating images to view inside your body, then it goes in a PACS system somewhere, because that's how they track it and keep up with it. Did you know that?
I did know that, actually.
So here's the thing is, for years, everybody's talked about the PACS systems not being secure. And it would drive me insane. But, I was just dealing with another company's data and another company's systems. And I'm like, seriously, this is how this works? Seriously? But nobody's made anything happen. But as over time, even NIST got involved. Our friends at NIST, they did a test run to see if we could take medical device information, take all the vendors and create a way to secure it end to end. That's how bad it is. And remember, we saw that panel speak, and even the engineers are like, yeah, this stuff's not secure. We're flabbergasted that there are devices that their default settings are wide open, let everybody see it.
Mm-hmm.
So anyway, both, and then it adds in the layer of, it's not my problem, it's your problem.
Right.
Yeah. So have you ever had a client ask you to secure their PAX server, David?
No, I actually haven't.
Yeah. So the vendors say that it's the customer's responsibility. The customers assume the vendors are doing it.
Yeah. So nobody's doing it.
Right. It's in a loop. And, they come in, they set it up, it works, and all the stuff can talk to it because it's wide open.
Mm-hmm.
And it's never included under what the IT vendors are supporting. But the other vendor, the vendor of the PAX systems and all the devices, say that your IT people should be securing it. So I see an infinite loop.
Yeah.
Yes.
Yeah. Secure it, but don't touch it.
Right. Indeed. So let's see, the article came out in September 2019. So here we are in February. And it's a German research company was testing for something, looking for security, and it was particularly, they were just worried about German stuff. And then all of a sudden they stumbled upon how many of these PAX servers were live available on the internet and how many images. And so when they first, ProPublica did it, and when they first talked with these folks, they had found 5 million patients, most of them from the United States. So they were like, hey, somebody from the United States should listen. Of course, that wasn't happening. And 187 servers just in the US that they had originally found. And in that original article, Jackie Singh, who is, I think, a CEO of a cybersecurity company, it's not even hacking. It's walking into an open door. And that goes back to what David said earlier. Doors are open. Come on in. But it's, another quote from Singh was, what we typically see in the healthcare industry is that there is Band-Aid upon Band-Aid applied to legacy computer systems.
Mm-hmm.
And we know, because, that's how it works.
Yeah, I just got finished doing the Band-Aid project.
Yeah, to peel the Band-Aids off, or you were adding another.
We were just replacing Band-Aids.
Oh, okay. See?
Yeah, it's pretty bad when you have to take Windows 10 systems and reinstall them to 32-bit so that they will run software.
Yeah. Okay.
Yeah.
So, that's a rabbit hole we don't need to go down, isn't it?
Yeah.
But it gets back to, the point they were making in the article is, cybersecurity is a shared responsibility today. And we've got to do more to get people to understand that. It's not you do this and I don't have to worry about it. It takes us all. And, on the flip side of it, it's, I got this, you don't need to know. Well, no, they do, because the more educated, users are, the better off they'll be, we hope.
Mm-hmm.
So anyway, they found all these images and they said, we're going to notify some people. And once we could figure out who they were with, I don't know about you, David, but I would have been concerned if they were calling me up.
Oh, yeah.
And there were some, they jumped on it. They were like, holy crap, I did not know this. There's a Los Angeles physician where it's an echocardiogram, so it's a cardiologist, and never did return their call.
Just one of them scam callers.
I'm not going to call you. Yeah. But there's another one that they notified called Offsite Image, and they had like 340,000 images. And it was interesting because it was both veterinarian and human doctors on the same archive there. It was interesting. And of course, their website, your data is safe and secure with us, while 340,000 images are just out there.
Well, yeah, I mean, they're securely available.
You won't get infected when you take them.
There's no privacy there, but we have security.
And of course, they contacted the company. The tech consultant said, that is no way. No, it's impossible. That all of our access requires passwords. Called back the next day and said, my bad. They were 340,000 images out there. I mean, how would they have found you? You know? Why would you say that's absolutely impossible when these people have found you? How?
Yeah.
But it's how people function. So, but he said,
like I said, though, at least he looked into it instead of just completely dismissing it.
Yeah, true that. So, but he said he was never aware that this was even a possibility.
Wow.
So, again, it would be like you getting the call and you're like, they say they enter passwords. When I did my risk analysis.
Yeah.
And that is the loop that everybody get in. They're just like, toot, toot, toot. It's, it's me, it's you. No, it's secure. And nobody's paying attention.
Right.
The sad thing is, this is not new. I mean, I told you, we've known about this for a while. And some, really smart people hang out at Harvard Medical School, at least, Harvard wants you to know that. And so the imaging people have research journals, just like everybody else. And in 2016, a couple of these folks said that PACS and DICOM, they're a mess. And the actual quote in their paper they published for everyone to see, despite more than 2 decades of active development and implementation, our radiology data remains insecure. That's 2016. We're not talking, 2009.
Wow.
And really and truly, my favorite quote from the whole paper was, suddenly medical security has become a do-it-yourself project.
Yeah, well, I hear doctors all the time. It's like, I'll just do it myself. I'm not paying that.
Uh-huh.
Really?
Yep.
That's what I thought next time, I need open heart surgery. I'll just do it myself.
Yeah. So after the story broke, lots of people are looking at it, right?
Mm-hmm.
And the number keeps going up. And then we see it's 400 million. Then it's 737 million. And then eventually by November, it's over 1 billion images are out there. And it just kept getting worse. And I don't know where the number ever did finally stop before they started to see it go down a little bit. But in January, Health Imaging was covering it. And they even said it's not even close to being resolved. It's getting worse. All these kind of things. They had 2,000 providers, 800 institutions. And it wasn't just, it was big hospitals, little clinics. And I told you, like a cardiology office. It's all of those different things. And mostly in the U.S. Even though we've been doing HIPAA, I know everything there is to know about HIPAA. And then they have this, map, and go figure, Georgia's one of the states that has a little on it.
Yeah.
Yeah.
Congratulations.
Thank you. Thank you so much. That we are so full of information here that we share it with everyone.
I don't think that's the information sharing they were talking about.
I know, right? So in November, a letter was sent the Senate Cybersecurity Caucus, which is Mark Warner, and we've talked about him doing stuff before when there's exposure of health data. And so he sends a letter to David's friend, Director Severino.
Mm-hmm.
And, because he's saying, look, just curious. It's not just a rhetorical question I'm asking here. It's very specific because he didn't just read the news and say, hey, what are you doing about this? They read the article, found one of the health services companies that were being exposed, and he reached out to them and said, "Hey, what the what?" Right?
Right.
And what's going on? How did this happen? Can you explain this to me? And in their response to his letter, they said they had successfully completed an HHS audit confirming compliance with the HIPAA security rule, the last of which concluded in March 2019, while patient images were accessible online. Okay. Now, so, but this Warner's getting this response from the healthcare, provider. And then he's like, but how could you, say that, confirm they're compliant when they got stuff online? So I don't know about you, but when I read that, I'm not getting out of it what, because Warner doesn't work in this. That's not, he's not a healthcare guy. He's a cybersecurity guy, and we get that.
Mm-hmm.
But that one statement, I had like 3 different problems with it of what they told him. Because we know they haven't been doing random audits, or at least they haven't publicly announced it, and I don't know that they're doing it. So if they were in there, they were doing an investigation.
Right.
Those are 2 different things.
Mm-hmm.
An audit's like, hey, spin the wheel. Spin the wheel of doom and see if you are selected for an audit. But the investigation part is, something happened, a complaint, you reported a data breach, something happened, and now I'm out here, having to check you out because of that. And they're looking at that specific thing that happened if it's an investigation, right?
Mm-hmm.
So if we assume that it was investigation, they could have been looking at some other problem, not anything to do with the PACS system.
Right. Yeah, it was not part of the scope.
Yeah. And if the company says that they secure the facts and they put it on their SRA and they show that they're actually testing those things, OCR doesn't have the staff to go run those scans themselves.
Mm-hmm.
So if they've got some tech person saying, yeah, you're good, but nobody knows to look at the PACS system because the tech people aren't supporting the PACS system, and nobody asked the PACS vendor to test it in the security risk analysis. So guess what? No one knew they were out there.
Right.
And, so there's those. And then there's the point that I don't think that OCR ever confirms that you're compliant.
No.
They don't tell anyone that they're compliant. They say, you're good for now.
Yeah. The only people that tell you that you're compliant are those people that give you that little badge of compliancy to put on your website.
Uh-huh. Yeah.
Oh, let's don't go down that path.
No. Because you know how we feel about you're compliant, guaranteed. No, you're not. If the people in charge do not tell you you're compliant, how can someone else? That's all I'm saying.
But they have a badge on their site.
I'm not going down that with you. I'm not talking about it. But at the same time, he's right. While he may not understand the way all of that works, but it certainly made OCR look bad because it's like, well, yeah, those images were exposed, but they told us we're good. And, so I can see how, there's some confusion there. But it doesn't mean that the system is working because we both know how that goes. I mean, I just explained how that could be a mess. Right there.
But I passed an audit, so what's the problem?
Yeah. And, it's not a full audit when they come in for investigation, I can assure you. I've dealt with those before. But every now and then, I'm helping people get through those, like yesterday. So, part of the letter, though, he said these reports indicate egregious privacy violations and represent a serious national security issue. The files may be altered, extracted, or used to spread malware across an organization. He's right there because he goes on, and in their current unencrypted state, CT, MRI, other diagnostic scans on the on the internet could be downloaded, injected with malicious code, re-uploaded into the medical system, and there's your favorite word, David.
Yeah. It's capable of propagating.
Yeah. It could then propagate across the whole thing. And it's not that's absolutely true.
Yep.
There is a design flaw in the DICOM protocol that would, you can do that. So, and not even be detected, because who's scanning the images? Clearly no one, because they're out there. So, he's absolutely right how serious this could be. And, imagine 800 providers being infected all at the same time with some seriously bad ransomware hitting their entire organization, or keyloggers, or any number of things. So, yeah, he said, Roger, I'm going to need you to answer some questions. And, of course, they always say, I want you to get back to me by blah. And, that gets a response of, thank you for your letter. We need to look into this. We're not going to be able to get back to you. I request an extension. Sure, you get it. We know how that works.
Yeah.
So anyway, as far as I know, we have not seen a public release of any response. But here are his questions. Did HHS receive a notice from US CERT regarding the open PACS port available with diagnostic imaging available on the internet without any restrictions? If so, what'd you do? Okay, fair enough. What evidence do you require organizations to produce during a HIPAA security rule audit? Are organizations asked to turn over their audit logs? How does OCR review the logs? Does OCR have information security experts on staff, or does it rely on external consultants as part of this audit?
Okay.
Yeah, that's a mess too.
Mm-hmm.
What are the follow-up procedures if an organization's log files reveal access to sensitive data from outside the United States, such as in this case? Because his point is the Germans found it.
Yeah.
And I know, talking with David Benson, and he's talking about, people travel all the time at CHOA, the Children's Healthcare of Atlanta, and it's a huge organization. But they monitor for anything coming in from out of the country and immediately contact that individual supervisor to say, are they in blah, 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 But, they're actively pursuing that. And then he says, please describe your information security audit process. That's always like, please describe all of the services you provide, David, in 100 words or less.
Yeah.
Please describe your oversight of the DICOM protocol and PACS security. Do you require organizations to implement access controls? Well, HIPAA does. If so, what kind? Do you require full disk encryption and authentication for PACS? Well, HIPAA does. It's just what people are doing. Are the DICOM protocol implementations included in the audits? So, we know the OCR doesn't have the manpower. They've got, thousands upon thousands of cases already and don't have the manpower to deal with those. So, anyway. So, other than item 1, of did they hear from CERT? So, because supposedly CERT, US CERT, which is the cyber, I don't remember what it is, but apparently the Germans notified CERT, and CERT notified somebody who never called back, or I don't know. I got nothing on how that all loop happened. So, but I feel pretty certain that I know the answer for 2, 3, 4, and 5. Don't you? Do you feel like you know the answer, or that I do?
The policies and procedures part?
Well, questions, 2, what evidence do you ask for? What are your follow-up? What's your audit? What do you do with PACS? So we know those.
Mm-hmm.
They ask for policies, procedures, and proof that you're following them.
Yep.
And, the audits, it can't be much more than that. Show me a security risk analysis, or, and the OCR staff, they look at the documentation, and sometimes, they'll ask for more because
Yeah.
baffling with BS happens.
Yeah. Well, I mean, when you're auditing logs, it's not like somebody's going to come in and say, show me all your access logs for the last 3 years, and then they're going to filter through those.
Yeah.
I mean, it's just not going to happen. I mean,
No.
you're talking, it's hard enough to
Massive.
do it from month to month. You can't do it 3 years. It would take you 6 years to audit 3 years worth of logs.
Yeah. You just can't. It's just not a possibility unless you're going to give them some technology that they could request the logs be dumped into this system that does that work. But
Right.
human doing it, no.
Mm-mm.
And they don't have those systems because they have a few tech folks, but, not a lot of them. So on number 3, they wouldn't see those files, but they would get assurances from the organization. So the organization would tell them,
Yeah, we did it.
we're doing it. But you can't just block things from, out of the U.S. because, well, that happened to me. I had everything blocked for our stuff. And then I went to Germany and couldn't get to anything. So my bad. So I now have a different policy. That means before I go out of the country now, I check and open up that space. But the last audit that they did do, that was, desktop. They asked for SRA risk management documentation.
Mm-hmm.
And frankly, you remember the results from that. Everybody did horrible.
Oh, yeah.
So, it's like when Severino was asked about, isn't it time to update the security rule? And he's like, we can't get them to do this.
Yeah.
If they're not doing this right, why do we add more for them to not do right?
Mm-hmm.
Because anything you add, this would be the basis. This is basic risk management.
Yeah. I mean, you still have people saying they're going to shut their practice down and they'll just pay the fine, or my insurance will cover it. I'm not worried about it.
Mm-hmm.
They still see this as simply a compliance issue, and that's not what it is.
Yep. Maybe you should testify in front of Warner's little caucus.
I shall.
All right. Help
I'll
me with
say-
HIPAA goes to the hill.
Yeah. I'll just stand there. I got one thing to say. HIPAA's not about compliance. It's about patient care. And I'll drop the mic and walk off.
Boom, mic drop. There you
Yeah. Yes. See this on C-SPAN.
go. That's why we don't let him out, people. So here's the sad thing is, the images are still out there. They're still out there.
Mm-hmm.
There's still millions upon millions out there. So, and most of them in the United States, I might add. So if you have any relation to a PACS system in your business, whether it's you have a BA that does it, you have any vendor that you send them to, you ask them, have they checked to make sure they're not one of these? And if they say, oh yeah, we're good, and they don't give you any details about how scary that article is, don't believe them.
Yeah. Give me assurances.
Yeah. And then even if they say they've looked into it, you want to know, because this should be a lesson
Mm-hmm.
that if you fix it, then you need to have different security policies and procedures because what you were doing wasn't working. So just prove that you are serious about that, not just, oh yeah, we got it, like that tech guy originally did.
Mm-hmm.
Because, any pushback you get from them for asking, well, we know what that means.
Yeah. Well, this obviously he didn't know what he didn't know. And that's not saying anything bad.
Well, yeah, I mean, all he said is it's not likely. But me, if I'm asking one of my vendors to tell me, and they're not going to tell me, this is a random person calling versus my relationship with my vendor, I should be able to ask.
Yeah. Yeah. But even your vendors aren't very forthcoming with information, because I request information from them all the time from different vendors, and you would be shocked at how much trouble it is to get something that should be so easy.
Yes.
Anyway.
We know. So, get out there and look, because these things, they can steal your images and, it's put it in their records. It is stuff. Or find something and blackmail people. I mean, it's crazy that this stuff is out there like at that level. And it's got all the patient name. Don't forget, it's identifiable information, almost all of it. And some of it even has social security numbers, because the way the system works is you can attach the notes about the study directly into the .com image.
Mm-hmm.
Well,
I guess the good thing is that, you know, if you want to avoid paying $650 for your x-rays, just go online and Google it. They're likely out there anyway. I mean, you know, it's hard for me to get copies of my x-rays, but I can Google it and I can get them.
Well then, you know, yet another exposure.
Yep. You've been exposed.
Hopefully it'll be better by the time you're exposed. Flasher. Yeah. You know, if you're old enough, you can remember, and they call him the Streak.
Yeah. Gotta love Ray Stevens.
The Streaker trend was something else.
Yeah.
All right. I'm done with this. I can't take it anymore. And we got through the episode.
Finally. I know. All right, folks. That is our show for today. So remember to follow us and share us out on your favorite social media. Rate our podcasting app. Yep. We have an app for that. It's in the app stores. Go get it. It's out there for everybody, just like your images. All right. And don't forget, Donna and myself, that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.